So the next topic is all about Philippine AIDS Prevention and Control Act of 1998 or the RA 8504. So the Philippine AIDS Prevention and Control Act of 1998 or the RA 8504 focuses on preventing HIV and AIDS spread and supporting affected individuals. So it mandates education and awareness programs across schools, workplace, and communities. So the Act ensures confidential, voluntary, and free testing, along with the accessible treatment and care. So it prohibits discriminations against people with HIV and AIDS and enforces strict confidentiality of their status. So the RA 8504 also created the Philippine National AIDS Council or the PNAC to oversee the country HIV and AIDS response. So the law promotes both public health and human rights for people affected by HIV and AIDS. Now, the reproductive health also concerns problems such as sexually transmitted infections. So according to Dr. Natividad in year 2013, in the Young Adult Fertility and Sexuality Study of 2013 or the YAPS-4, a survey of Filipino college and high school graduates, 36.2% and 43.5% respectively admitted to having engaged in premarital sex. So in addition, the 66.7% and 79.6% did not use any protections at first premarital sex. So these scenarios are most often the causes of infections. So let's elaborate more what is that mean. So the Young Adult Fertility and Sexuality Study of 2013 or the YAPS-4 led by Dr. Natividad brings to light significant reproductive health challenges faced by young Filipinos, particularly in relation to sexually transmitted infections or the STIs. So the study surveyed young adults who had completed high school and college, providing insight into their sexual behaviors, use of protections, and overall awareness of reproductive health risks. So number one, we have the prevalence of premarital sex. So YAPS-4 found that 32.2% of Filipino college graduates and 43.5% of high school graduates reported that engaging in premarital sex. This high prevalence suggests that a significant portion of young Filipino in the Philippines are sexually active before marriage. Number two, we have the lack of protection. The study also revealed that 66.7% of college graduates and 79.6% of high school graduates didn't use any form of protection, such as condoms during their first sexual encounters. So, this lack of protective measures exposes them to higher risk or contracting STIs and unintended pregnancies. So for many, the lack of awareness, access to contraceptions, or social stigma around buying protection could be reason for this behavior. Number three, increased risk of STIs and unintended pregnancies. So unprotected premarital sex is one of the primary risk factors for sexually transmitted infections or the STIs, including the HIV or the AIDS. So young people engaging in unprotected sex without adequate knowledge about STIs are more vulnerable to these health issues. So moreover, unintended pregnancies can also result which may have long-term social or the economic and the health impacts for young individuals. Now, what is the implication and challenges? So the findings from YAPS 4 highlights gaps in sexual education and reproductive health services in the Philippines without adequate information and resources, many young people are not equipped to make safe and informed decisions about their sexual health. So some of the barriers include the limited access to sexual health education. So comprehensive sexual education that covers topics like STIs, contraceptions, and safe sex practices is not consistently provided in school. So many young people may rely on missing information from peers or online sources leading to unsafe practices. Number two, we have the stigma around sexual health. In the Philippines, there is often a social stigma associated with discussing sexual health openly. So this can deter young people from seeking information about protection or accessing contraceptives. So particularly for those who fear judgment from healthcare providers, family, or their community. And number three, need for accessible health services. So many young people lack access to youth-friendly reproductive health services where they can obtain contraceptives and undergo testing with or without fear or embarrassment. So what I can recommend or the recommendations for this. So number one, we have to enhance reproductive health educations. Schools and communities could benefit from comprehensive sexual education programs that cover safe sex practices from STI prevention and the importance of protections. Number two, we have the youth-friendly healthcare services. So clinics and health centers should offer non-judgmental or confidential and accessible sexual health services, making it easier for young people to seek contraceptions and testing. And number three, community and parental engagement. Families and communities should be encouraged to have open discussion about reproductive health. When young people feel supported, they are more likely to make informed decisions regarding their health. So the findings from DEPS 4 underscore the importance of addressing reproductive health issues among our Filipinos youth through the education, accessible services, and supportive communities. This effort could significantly reduce the incidence of STIs and promote overall health and well-being among young Filipinos. So next, acquired immunodeficiency syndrome or AIDS is caused by human immunodeficiency virus or HIV, which usually does not have symptoms in its early stage. Initially, people with HIV were diagnosed as having AIDS only. When they develop blood infection, the cancer known as the Kaposi's sarcoma or any of the 21 other indicator disease from Donatelli in year 2006. In addition, HIV is highly infectious through unprotected sexual intercourse, breastfeeding of an infected mother to infant, and blood transfusion and injecting drugs, needles used for infected patients. So let's elaborate or explain that. So acquired immunodeficiency syndrome or the AIDS is the advanced stage in infection or of infection caused by the human immunodeficiency virus or the HIV. So in its early stage, HIV often does not present noticeable symptoms, making it difficult for individuals to know they are infected. So the asymptomatic nature of HIV can lead to delayed diagnosis and treatment. So number one, we have the progression from HIV to AIDS. So initially, individuals diagnosed with HIV were not classified as having AIDS until they developed certain served condition or indicator disease. So according to Donatelli in in year 2006, these conditions include life-threatening infections, so cancers such as the Kaposis sarcoma and list of 21 other diseases. So that signals progression of HIV to AIDS. So the presence of this condition indicates that the immune system has been significantly compromised. Number 2, modes of transmissions. Under the modes of transmissions, we have the underprotected or unprotected sexual intercourse. So HIV is highly infectious and can be transmitted through vaginal or anal or oral sex without the use of condoms or any protective measures. This is one of the most common routes of transmission. Next, we have the breastfeeding. An infected mother can transmit HIV to her infant during breastfeeding. So this emphasizes the importance of counseling and support for HIV-positive mothers regarding safe feeding options. And last, we have the blood transfusion and shared needles. So HIV can also be spread through transfusions of contaminated blood or through the sharing of needles among individuals who inject drugs. So this particularly concerning in the context where blood screening and safe injections practices may not be strictly enforced. So this is the importance of awareness and prevention. So understanding how HIV is transmitted in progression to AIDS is a crucial for prevention efforts. So number 1, we have the education and awareness. Increasing public knowledge about HIV transmission, symptoms, and importance of regular testing is essential. So awareness campaigns can help destigmatize the virus and encourage people to seek testing and treatment. Next, we have the safe practices, promoting the use of condoms during sexual activity and ensuring access to sterilized needles for those who inject drugs can significantly reduce risk in transmissions. And last, treatment and support. Early diagnosis and antiretroviral therapy or ART can help manage HIV effectively, preventing the progressions to AIDS and allowing individuals to lead healthy lives. So, moreover, support services for HIV positive individuals can help mitigate the social stigma associated with the virus. So, AIDS is serious conditions resulting from untreated HIV infections, and understanding its transmission routes is critical for implementing effective public health strategies. So education, prevention, and treatment play pivotal roles in combating the spread of HIV and improving the health outcomes of those affected. The Republic Act number 8504 or the Philippine AIDS Prevention and Control Act of 1998 was passed by the Congress on July 28 in 1997. So the act promulgates policies and prescribing measures for the prevention and control of HIV and AIDS. In the Philippines, instituting a national HIV or AIDS information and educational program establishing a comprehensive HIV and AIDS monitoring system, strength, and Philippine National AIDS Council and 4 other purposes or the PNAC. Now, the Republic Act number 8504, also known the Philippine AIDS Prevention and Control Act of 1998, was enacted by Philippine Congress on July 28 in 1997 to address the growing concern of HIV and AIDS in the country. So this landmark legislation established comprehensive framework aimed at prevention and controlling the spread of HIV and AIDS while also promoting the rights and welfare of individuals affected by the virus. So number 1, we have the policy framework for prevention and control. So the act outlines policies and measures designed to prevent the transmission of HIV and manage the impact of epidemic. So this includes a focus on education's awareness and community engagement to combat stigma and misinformation about HIV and AIDS. Number 2, we have the national information and educational programs. So a significant emphasis is placed on creating implementing HIV/AIDS information and educational programs throughout the country. These programs aims to inform the public about HIV transmission and prevention strategies and importance of testing and treatment. Number 3, we have the comprehensive HIV and AIDS monitoring system. So the law calls for the establishment of monitoring system to track the incidence and relevance of HIV and AIDS. So this system helps in collecting data to inform policy decisions and allocate resources effectively to combat the epidemic. And number 4, strengthening the Philippine National AIDS Council or the PNAC. So the RA 8504 reinforces the role of Philippine National AIDS Council or the PNAC, which is tasked with coordinating the national response to HIV or AIDS. So the council oversees the implementation of the act, promotes collaborations among the government agencies and stakeholders, and ensures that programs are effective and responsive to the needs of those affected. And number 5, we have the protection and human rights. So the act promotes and the protection of the rights of people living with the HIV and AIDS, ensuring they are treated with dignity and respect. It prohibits discriminations in various sectors including employment, education, and healthcare, fostering an inclusive environment for those affected. So the impact of the RA 8504, the Philippine AIDS Prevention and Control Act of 1998 represent a crucial step in the Philippines' response to the HIV and AIDS epidemic. So by establishing policies for prevention educations and monitoring as well as enforcing human rights protections, the Act aims to reduce transmission rates, improve the quality of life. So for those living with HIV or AIDS and mitigate the social stigma associated with the virus. So in summary, RA 8504 is comprehensive legislative measure that seeks to empower communities, enhance public health response, and support individuals affected by the HIV and AIDS. So throughout education, monitoring, and protection of their rights. So the Act also provides for educational and information dissemination in various institutions and agencies. So safe practices and procedures, testing, screening, and counseling, and health organization and association. So monitoring of cases with confidentially and programs for anti-discriminatory acts in the workplace, hospital, and the other public institutions. So let's explain that. Now, we have the key preventions of RA 8504. So what is that? So the number 1, we have the education and information dissemination. The Act mandates the implementation of education programs in various institutions and agencies. This includes schools, universities, workplace, and community organizations, ensuring that accurate information about HIV and AIDS is widely available. And this program aims to enhance public awareness about the transmission, prevention, and the treatment of HIV. Number 2, we have the safe practices and procedures. It established guidelines for safe practices in healthcare settings, include testing, screening, and counseling services. So health organizations and associations are required to adopt this procedure to ensure that individuals seeking testing and treatment receive safe, confidential care. This encourages people to come forward for testing without fear of stigma or discrimination. Number 3, we have the confidentiality in monitoring cases. So the Act emphasizes the importance of confidentiality in the monitoring of HIV or AIDS. So cases, it ensures that individual health information is protected, promoting trust in health services. This confidentiality is crucial for encouraging people to access testing and treatment services without the fear of having their status disclosed. And number 4, programs for anti-discrimination. So the RA 8504 includes provision for the implementation of programs that address anti-discrimination or anti-discriminatory acts in various settings such as the workplace, hospitals, and public institutions. So these programs aim to create a more inclusive environment for individuals living with HIV and AIDS, ensuring they receive equal treatment and the access to services without facing discrimination. So the importance of this provision is these provisions are vital for creating supportive environment for individuals affected by HIV or the AIDS. So by focusing on educational and awareness, the Act seeks to dispel myths and misconceptions surrounding the virus. So implementing safe practices in healthcare setting ensure that individuals can seek necessary services or confidently. So the emphasis of confidentiality protects individuals' rights and encourages more people to access testing and treatment. So finally, anti-discrimination programs promote social equity, ensuring that those living with HIV and AIDS are treated with dignity and respect. So that is the end of our discussions for today of existing national laws related health trends and issues and concerns. So thank you for listening, and I hope you learned something new.